Now I'd like to discuss some key points with regard to the rotator cuff muscles. When we think of the rotator cuff muscles, automatically we think of the four muscles: the supraspinatus, infraspinatus, teres minor, and then on the front of the scapula here we have the subscapularis. Now with the exception of the supraspinatus, the other three rotator cuff muscles act to pull the head of the humerus in and depress it slightly in the joint space here, and that resists the upward pull of the deltoid as it performs the glenohumeral abduction. Now, something else that we should consider are all the fascial connections of the rotator cuff muscles. I'm just going to spin the skeleton around here. If we look at the back here, for example, we have the infraspinatus in this fossa here. Now, there's some superficial connections into the trapezius in this area. If we were to slide forward into this area and kind of follow the supraspinatus through, coming around, there's actually deep fascia that comes into this area, the clavicle pectoral fascia, as well as fascia that radiates further down and covers the ribs in the serratus anterior. Now, why this is important is because we often think as rotator cuff injuries being localized, but because of the neurological connections and fascial connections throughout this area, we may have a rotator cuff problem that actually presents as a bit of a breathing dysfunction, or vice versa. There may be a restriction further up from the rotator cuff into the neck. And as a practitioner, you have to be able to kind of decipher what you're seeing in clinic and analyze your patient so that you can figure out what may be interconnected. Because sometimes there are fascial connections that we naturally don't really associate with one another, but by understanding these deeper and investing layers, you can see the interconnections through various regions. Now, coming back to this part of the skeleton, if we think of the infraspinatus and the supraspinatus, we always approach this fascially, but sometimes what we forget to think of are actually nerve entrapments that may occur in this area. Now, infraspinatus and supraspinatus are innervated by the suprascapular nerve, while the teres minor here is innervated by the axillary nerve. And we actually have some really great nerve flossing exercises that I'll demonstrate shortly that we often prescribe to our patients. When it comes to the subscapularis muscle on the front of the scapula there, we actually have a great MSR protocol that you can look up later that will address any nerve entrapment, specifically the upper and lower subscapular nerve there in the axillary fascia. So, spinning this guy back around this way, let me demonstrate the nerve flossing exercises here. I'm going to break them down into 3 steps each, just so that you can coach your patients in doing this. It'll be a lot easier. So starting out with the suprascapular nerve, what you want to do is you're going to have your patient kind of stand in a neutral position. The first movement that you'll have them do is laterally flex their neck to the opposite side. Okay. Now the second movement would be to abduct the arm and bring it overhead in the same direction as neck movement. And then lastly, you're going to extend the wrist and fingers. So I'm going to break this down again. So starting out, we have lateral flexion away from the side of impingement. We're going to abduct the arm and bring it overhead. And then we're going to extend the wrist and fingers. So now I'll do the combined movement here. There we go. And you want to hold those end ranges for a few seconds and probably perform this, 3 to 5 times on each side. Oh, well, specifically on the side that's entrapped, but it doesn't hurt to do both sides. Everything's connected. Now, looking at the teres minor, we're thinking axillary nerve now. So for that one, first movement is going to be to elevate the shoulder, and then you're going to bring the neck laterally flexed to that same side. So this is the starting position for your patient. So you'd want to have them practice this a few times. So you can elevate the shoulder, laterally flex the neck to that side. So that's the starting position. Now, when you start with the nerve flossing, you're going to simultaneously, you're going to depress the shoulder and move the neck to the opposite side. Okay, so that would be the first part. So once again, we're dropping the shoulder, laterally flexing away. Now you're going to add an arm movement. You're going to internally rotate your arm. So starting again, you're laterally flexing away, depressing the shoulder, internally rotating the arm. And then the last component is going to be extending the wrists and fingers. So we're starting out like this again, dropping the shoulder, laterally flexing away, internally rotating the arm, and then extending the wrist and fingers. And so once again, the combined movement. There, and hold that in range for a few seconds. And so you'd want to perform that about 3 to 5 times. So those are just a few things that we'll prescribe to our patients and just some thoughts on the rotator cuff.